So now we know the different types of X-ray mastoid, and what about nose and paranasal sinus? Okay. So in the nose, the usual one is fracture of nasal bone. So in the nose, we take X-ray of nasal bone. Okay, X-ray nasal bone. X-ray nasal bone is usually a lateral view. Plain X-ray nasal bone, lateral view. We take both right lateral and left lateral. So if there is a fracture, you can see the fracture line, and also elevation or depression of the fracture segments are very clearly seen in X-ray, plain X-ray nasal bone lateral view. And in this, one thing you have to remember, that I will show you in the X-ray, that there is a groove for ethmoid nerves and vessels, and that should not be mistaken for a fracture line. Okay, in exam it's a usual fault done by the students, that you will mistake the groove for ethmoid nerves and vessels, and incorrect diagnosis of X-ray fracture bone is made. So that should not be done. That I will show you in X-ray. Okay. And what about the paranasal sinus? So in paranasal sinus we usually take Waters view or occipito-Mendel view. Or Waters. So this view is most common X-ray view taken for X-ray paranasal sinus. In this is actually nose chin view. Okay. And in this you can see all the sinuses, and if you want to see the sphenoid sinus, you have to take a modified Waters view, that is Waters view with open mouth. Normally the Waters view or occipito-Mendel view, the mouth is closed, and if you take a modified Waters view, that is occipito-Mendel view with open mouth, you can see the sphenoid sinus also. And this view is specific for maxillary sinus. This is usually asked in MCQs. So Waters view is mainly for maxillary sinus. Okay, and what are the other views? There are also so many other views, like occipito-frontal view or Caldwel view. In that also you can see all the sinuses, but this is best for frontal sinus. Again another MCQ. And Submentovertical view or skull base view is for which sinus is located in the skull base? That is a sphenoid. So it is for sphenoid. And lateral oblique view is for ethmoid. Okay. So in the X-ray, usually the sinuses, plain X-ray, the sinus will appear as air-filled translucent cavities. And if there is an opacity, it is compared with the opacity of orbit. If it is less than the opacity of orbit, it is usually regarded as normal, and if it is more towards high density, it can be due to tumor or any mucus, or it can be due to fluid. Okay. So if there is an opacity, increased opacity means there is a fluid, or there is thickened mucosa, or due to tumors. And exact diagnosis is only after doing a thorough clinical examination. And now we can see the X-rays of nose and paranasal sinus. In the nose, we take X-ray for nasal bone fractures. So this is plain X-ray, lateral view of nasal bone. Both right lateral view and left lateral views are taken. Plain X-ray of right lateral view, plain X-ray nose, right lateral view. And here again, see, this is anterior table and posterior table with the frontal sinus, and coming down this is the nasal bone. Usually the students will mistake this groove as the fracture line, but this is a groove for ethmoid nerve and vessel, and that will run downwards and forwards. So this should not be mistaken for fracture line. Always you have to differentiate this fracture line for the groove for ethmoid nerve and vessel, which also run downwards and forward, and this should not be mistaken for the fracture line. Here this is the groove for ethmoid nerve and vessel, and this is a different fracture line on right lateral view. Put both sides. This is a normal, and this is a fracture line. So this line should not be confused with the fracture line. Okay. This again an X-ray nasal bone lateral view, right side, left side is also there. Can you see? Here is a fracture. The tip of nasal bone there is a fracture. Okay, fracture nasal bone. And you can see that here also this is a nasal bone with a fracture at the tip of nasal bone. In this you can see that very clearly. X-ray nasal bone lateral view. This is the X-ray nasal bone showing fracture. Two fracture lines are there, 1 and 2. Okay, it's very clear here. Right? This is an X-ray nasal bone, right side and left side. And here you can see fracture of the nasal bone on left side. And it is normal on right side, but there is fracture on left side. See, this side it is fractured and this side it is normal. So the left lateral view showing X-ray fracture of nasal bone on left side and it is normal on right side. This is X-ray of paranasal sinus. We have already taken the anatomy of all the paranasal sinuses, and this is X-ray of paranasal sinus. And what is the view of this? This is occipitomental view. You are lucky that it is written here, but sometimes this will not be written also. So the most commonly taken view is an occipitomental view or 30-degree occipitomental view or Waters view. And in this you can see all the sinuses. Let me tell you, this is the shadow of orbit, then the nasal cavity, and between the orbit and the nasal cavity comes the ethmoid sinus both side. This is the frontal sinus, maxillary, and since this is an occipitomental view with open mouth, you can see the sphenoid sinus also. These are the sphenoid sinuses. And this occipitomental view or Waters view is ideal for maxillary sinus. Okay, whereas the ideal view for frontal sinus is Caldwel view or occipitofrontal view. Okay, it's a Caldwel view. This occipitomental view is ideal for this maxillary sinus, M for M, and frontal, occipitofrontal for frontal, F for F, that is occipitofrontal view, otherwise called Caldwel view. X-ray appearance, a typical normal X-ray appearance of the frontal sinus. This appearance is called scalloping. Okay, scalloping view, meaning the outer shell. This is the scalloping view. This is normal, and the absence of the scalloping with expansion of the sinus cavity is seen in frontal mucosal. Okay, the paranasal sinus X-ray, occipitomental view with the open mouth. What is this? This is this patient had an RTA, and there is wiring done on the maxilla. That is it. Okay. And this is occipitomental view with open mouth, again showing always while reading an X-ray, go in a systematic way, identify the landmarks, anatomical landmarks, and then go. In an X-ray paranasal sinus, start with the orbital shadow and the nasal shadow, and above that you will get the frontal sinus, and on side, on the cheek, you will get the maxillary sinus, and if it is an open mouth, you can also see the sphenoid sinus. See, these are the sphenoid sinus with the sphenoidal septum, very clearly seen. So what is the finding here? Here you can always see the side also. Here it is written left side, so this is right side and this is left side. So you have to tell us this is X-ray paranasal sinus occipitomental view or Waters view with open mouth, showing haziness on both maxillary sinus and more on left side. See, this is a right side and this is left side. So in left side there is complete haziness is seen. Plain X-ray paranasal sinus occipitomental view. And what is the finding here? It's very clear. You can see the haziness on the, this is right side, so this on the left maxillary sinus with the air fluid level. So this is usually pointing towards an case of an acute sinusitis. So Waters view in standing position, and if erect, see Waters view in erect position or standing position, and if showing an air fluid level in the maxillary sinus, mostly in case of an acute sinusitis. Acute maxillary sinusitis on left side is the diagnosis. So X-ray paranasal sinus. As I have already told, always go in a systematic way, identifying the landmarks. So if you get an X-ray, first identify the orbital, then the nasal cavity, then the frontal sinus, ethmoid sinus, maxillary sinus, and in open mouth you can see the sphenoid sinus also. So here there is air fluid level in the left maxillary sinus. Mostly the diagnosis is an acute left maxillary sinusitis. X-ray, this is again an X-ray of paranasal sinus, Waters view with open mouth, and tracing the anatomical landmark, orbit, and the nasal cavity, and this is the oral cavity. So this is frontal sinus. Can you see the typical scalloping appearance here? No. I've already told you, loss of scalloping with expansion of sinus is typically seen in a frontal mucocele. See, this is case of frontal mucocele. Along with there is haziness in both maxillary sinus and more on the left side. Tell the finding in the X-ray. Okay, that will be the better way than giving a diagnosis. And the diagnosis always correlate with the X-ray finding with the clinical finding. Then only you can give a correct diagnosis. X-ray paranasal sinus, Waters view or occipitomental view with the open mouth, showing orbit is here, nasal bone, nasal cavity, then the frontal sinus with the typical galloping appearance, and maxillary sinus on right side, maxillary sinus on left side, and ethmoids. And since this is an open mouth, you can also see the sphenoid sinus. So the opacity of the maxillary sinus or any sinus is compared with that of the orbit. If it is more opaque than orbit, it is pathological. So in this case, what is the finding? X-ray paranasal sinus, occipitomental view with open mouth showing opacity in the left maxillary sinus. So the differential diagnosis of opacity of maxillary sinus you have to study. Again, X-ray paranasal sinus, occipitomental view or Waters view with open mouth. Open mouth is to see the sphenoid sinus. See, both sinuses, sphenoid sinuses are seen. And what is the finding here? Again there is opacity, or again there is haziness on right frontal, maxillary and sphenoid compared to the left side, isn't it? Right side is more hazy than on the left side. So you can tell it as a left pan sinusitis because the frontal, the ethmoid, maxillary and sphenoid are affected here. Here, what is the finding? Haziness in the right maxillary sinus. The orbit, frontal and ethmoid and also the sphenoid sinus are normal. There is only haziness in the right maxillary sinus. And what about this? This is also X-ray paranasal sinus, occipitomental view or Waters view with open mouth. Here you can see what is this. These two. What is this? This is an infraorbital foramen, bilateral. See, infraorbital foramen. Okay. Otherwise, this is appears to be normal except a minimal haziness or opacity in both maxillary sinuses. Otherwise, it is normal. This is infraorbital foramen. Again, paranasal sinus with opacity in right. This is left, and so this is right maxillary sinus. Frontal sinus normal, ethmoid normal. There is also opacity in the right sphenoid sinus also. See here, compared to the left side, there is an opacity or haziness on left, right maxillary as well as right sphenoid sinus. Okay. Sinus with the bilateral maxillary sinus haziness. The differential diagnosis of haziness or opacity of maxillary sinus was already told to you. So bilateral maxillary sinus haziness, X-ray paranasal sinus, Waters view with open mouth showing bilateral opacity or haziness in bilateral maxillary sinus. History of keeping foreign body into the nose. And on X-ray, he found to have 3 pellets, small iron pellets was put into the nose and it was removed with endoscope under general anesthesia. So X-ray paranasal sinus. In children it's like this. There is no frontal sinus is yet to develop. Okay. Only the ethmoids are developed in small children.